2 28-year-old men, COVID infection at risk of going into acute respiratory failure. We need 2 ICU beds, stat.
But we only have 1 bed left. Differences in patient status or history?
Both in urgent need of care. Only difference is the first is vaccinated, the other unvaccinated.
What do I do? Help! What should I do?
If you don't have an answer, then welcome to the medical world during a pandemic, where the sole difference between patients is often the vaccination status. In such a case, who should have priority, or can we even use vaccination status as a deciding factor?
According to Dr. David Magnus, director of the Stanford Center for Biomedical Ethics, there are 3 competing theories of justice which one can always base a so-called triage decision on: egalitarianism, the doctrine of absolute equality,
prioritarianism, or the rule of rescue, fundamental to the continued reinforcement of our belief in the great value of every human life,
and utilitarianism, a principle based on benefit maximization.
Starting with egalitarianism, the simplest concept of fair distribution, it becomes clear that drawing lots is the only just way to decide the recipient of the ICU bed.
The problem with such absolute equality of chance and result is that it also means treating patients discriminately as medical urgency is not considered. Keeping this in mind, we must turn to prioritarianism, with which one could argue that the unvaccinated get priority as they are typically more vulnerable to severe complications of a COVID infection.
However, this argument can directly be turned around in favor of the vaccinated when looking at it from a utilitarist view, as the vaccinated have a better chance to recover. Limited resources could become vacant more quickly to be allocated to more people in need, hence saving more lives.
Nevertheless, the difficulty in making the quick and accurate patient assessments needed to formulate the aforementioned arguments makes it almost impossible to stay on a purely biological level during a triage decision. This is the reason why many are beginning to consider the goal of benefit maximization on a societal level. The question changes from what benefits the individual patients more to what benefits society more.
As the vaccinated play an integral part in reaching herd immunity and thus in stopping the spread and mutation of COVID-19, while the unvaccinated are responsible statistically for putting additional strain on the healthcare system, abandoning their responsibility to the general will, as Rousseau would say, many claim the vaccinated should be prioritized.
Some even go one step further, arguing with Locke's theory of a social contract made through the mutual relinquishment of a part of our natural freedom in order to gain societal benefits. That being said, the unwillingness of the unvaccinated to yield their absolute autonomy means that they must be ready to forego society's benefits, such as an ICU bed.
But can we even divide society into the simplistic categories of vaccinated and unvaccinated? We definitely don't think so. Just think about minors unable to legally enforce their will, or minorities like the American Black community with an inherent distrust in the government, or just people who for medical reasons cannot be vaccinated. By ignoring this fact that we as a community are much more multifaceted, we risk disregarding founding principles of our free, prosperous society, such as the inviolability of human dignity anchored in our Constitution.
Therefore, we believe that every triage decision should be considered case by case and based on a medical evaluation of urgency and potential of recovery, to give all, even those with pre-existing conditions or disabilities, a right to an ICU bed, whilst also heeding the medical imperative to save as many lives as possible. A lottery system, on the other hand, cannot be employed in any decision, as it means giving up our inherent responsibility to use our reason as autonomous, enlightened creatures.
But even after careful consideration of both sides, every triage decision can still be seen as ambiguous, especially regarding the fact that there are no laws, only guidelines that steer a physician's decision. Therefore, as much as we wish the burden of deciding who gets to live and die never falls upon our shoulders, we must make sure it doesn't upon others.
Please protect me from having to make this decision. Protect me by following COVID regulations. Protect me by being vaccinated.